My name is Adebimpe Adekombi, the Digital Health Coordinator at Shaw Medical. The BPR Home project is a very good initiative which we embraced at our PCN. We've been inviting patients opportunistically into the BPR Home service, whereby they are asked to, once their BP is not on target, they are asked to do some home monitoring, either through the hypertension monitoring app, that is VISO, or for those that do not want to use the VISO, we have the service of them filling a BPR home diary, which once they submit, they are attended to by a clinician depending on what their results is. And we've had a good results thus far with it, seeing patients being moved from being not on target to being on target. And for those that use the VISO app, it has really improved the time in which we get them to have an appointment, because the app prompts them monthly on when to do their BP readings, and once when we receive them directly at the surgery, and once that is gotten, they're invited to see the clinician either via phone call, because we know most people are busy, and because of the target audience, majorly those that are upward mobile people that work. So we usually ask them to book in for a phone call, which we've seen good response with. And once they are called, they discuss with the clinician, and we've seen improvements in their BP target. People that are usually at risk, and we've been able to get their BPs to being on target. And for those that have issues with the digital tools, we also provide support for them. We have digital clinics where we teach people how, we explain and help them troubleshoot on either the NHS app or the BPR Home app, and get them to understand how to use it. We have these support sessions at all our practices once a month, and thus far that's been a very good program, and there have been lots of improvements, and we'll continue to call in patients to onboard on the VISO app, or to send in their blood pressure readings so that they can be brought to target. Right now, using the VISO app has actually improved the turnaround time of getting people's blood pressure readings, because usually if you have to submit it manually, it will have to go through different stages. But we've been improving on that, on our manual when people submit at the surgery. But using the VISO app has significantly cut the time it takes. And also we have pharmacists and nurses that attend to it, so you don't have to wait the long time to get a GP appointment. We've reduced that, and so we've had, throughout this service this year, we've had quite a number of patients, almost 1,100 patients that have been on the service, and we've seen great improvements in their blood pressure. People moving from the high risk groups of being at the time of onboarding, of being in group 1 or group 2 high risk group, they've been able to move down to the group 3 tag areas where their BP are on target. We've had massive improvements, both for the patients and also for our workforce. During my digital clinics, I've been able to support quite a number, especially the elderly ones. And all they just need is someone to be patient with them, to guide them through how to do it. And once they are good to go, actually. They're good to go. And seeing those, being able to see using technology to improve and make things better, especially even in the surgery. The BPR Home project is actually when we onboard people on the app, it has really improved our turnaround time and reduced the workload on our workflow team, having to calculate the BP, the average, and all that. It has really reduced that area. Thank you.